Good afternoon, colleagues from Brazil and United States. My name is Professor Carlotti, and I am Provost of Postgraduate Studies at the University of São Paulo. I would like to welcome you all to this international forum heading to the new normal, how COVID-19 is changing higher education and the perspectives for university research and teaching. This event is organized by the Postgraduate Office of the University of São Paulo with the participation of the Institute of Biology at the University of Brasília and also Fulbright Commission. We have already had 3 very exciting events, and today you have the opportunity to hear the insights and the perspectives from Brazil and USA. By sharing various perceptions, we can learn from other universities in Brazil and abroad during these forums. We will be presented to several institutional plans for moving ahead. For the 4th forum, we have 2 very high qualified speakers. The first is Professor Robert Robbins, who is actually the president of the University of Arizona. Our second speaker is Professor Rui Oppermann, former president of the Federal University of Rio Grande do Sul. Each one of you will have 15 to 20 minutes to address your view on this particular subject and highlight possible scenarios for the post-COVID-19 area. After the presentations, we will have time for questions from our audience. So please, Professor Roberts.
Thank you, Provost. And as I was saying to you in the virtual green room before we get started, my college roommate in the United States was Brazilian national juniors tennis champion. And although I know a very small amount of Portuguese, I apologize that I'm going to read most of my comments in English today, but thank you very much for inviting me to participate. So I will read a rather lengthy introduction about the University of Arizona, but I very much look forward to the discussion period and questions. So I'll begin now. So hello, everyone, and thank you so much for being here today. I'm glad to have the opportunity to speak with you. While we face significant challenges at the universities across the world and in our society today, I'm excited for the future of the University of Arizona and for higher education worldwide. The University of Arizona is a major public research university with over 45,000 students, primarily located on our main campus in Tucson, Arizona, which is in the south, about 90 miles south of Phoenix, Arizona. We're home to 2 independently accredited medical schools, one here in Tucson and one in Phoenix, as well as a statewide cooperative extension network responsible for translating research for the good of the state and its communities. Just over 70 miles north of the United States-Mexico border, we have very strong ties to Mexico, particularly our sister state of Sonora right across the border, as well as throughout South America and in other regions of the world. This global pandemic has introduced new challenges, but in many ways, it's also revealed the extent of challenges we already faced, as well as opportunities our institutions have for leadership and positive impact on society. When the COVID-19 virus began to reach the United States, our university acted quickly. In mid-March, over our spring break, we transitioned to remote and online learning. Our faculty and staff did heroic work to adapt courses and teaching methods to a remote online context. Except for critical research areas that could not pause because of animal colonies, and we have many very important NASA-led projects exploring space, our labs closed. Labs began to apply to reopen through a rigorous checklist to ensure the research operation could be restarted safely with appropriate physical distancing and other protective measures in place. As of last Friday, September 18th, 752 of our labs, or 88% of our total, were open and operating well, without any major transmission of disease in our laboratories. We have also shifted focus in many cases to serve the immediate needs of our state and global society in the face of this pandemic. A major part of this is assisting in public health efforts, with experts from our College of Public Health contributing to statewide planning and policy efforts. In addition, thanks to the leadership of Dr. Janko Nikolic-Zokit and Dr. Deepta Bhattacharya and their teams, we developed and began deploying an antibody test that is among the very best in our country. The testing program is providing data that allows us to better understand the true spread of the virus in our community and state, and how the human body responds to the infection, both of which can help inform public policy. The changes I've described are all in context for our commitment to keep serving our students so that they continue to make progress toward their academic goals. I cannot think of how we can do organic chemistry labs, gross anatomy labs, or dance studios online. There are many courses like this, and we know we needed to find a way to return to campus if at all possible. Early on, I asked Dr. Richard Carmona, who served as the 17th Surgeon General for the United States and a longtime faculty member in both medicine and public health at the University of Arizona, to lead our efforts to prepare for a safe return to classes in the fall. Dr. Carmona assembled a team of professionals and faculty members in an incident command system, or ICS model, a highly efficient and effective structure for gathering, analyzing, and making use of large amounts of information during a crisis. Working with our faculty and staff, the ICS has monitored public health conditions while developing a reentry plan. Our test, trace, and treat strategy is designed to minimize the spread of COVID-19 while providing students an immersive learning experience, whether they're on campus or learning remotely. We knew very early on that testing would be very critical, and we knew that we would be at the end of a very long supply chain for testing supplies. Leaders in our health science division created supply chains to enable testing on our campuses, and we provided testing kits to partners in municipalities in Arizona, as well as our 22 Native American nations. Thanks to the leadership and work of Dr. David Harris, who directs our Health Sciences Biorepository, and Dr. Ryan Sprisler, who manages the University of Arizona Genomics Core, we have a robust testing program on our campus. We tested every student who moved into our residential dormitories in August and have currently supplies and capacity for 1,600 antigen tests a day and 1,700 PCR tests per week. Tests are available to both on-campus and off-campus students, as well as faculty and staff, and all at no cost to the individuals being tested. In addition to testing, we have implemented a hierarchy of controls to limit the spread of COVID-19 on our campuses. These include having fewer people on campus, to engineering controls like improved air filtration and administrative controls like intensified cleaning in our buildings. The trace part of our plan means contact tracing. Traditional contact tracing is done in collaboration with local officials, and students and faculty and staff members in the College of Public Health are conducting contact tracing across our campuses. We're enhancing and scaling this approach with a COVID-19 Watch Arizona. This fully anonymous exposure detection app lets users know that they've been near someone with COVID-19 and what the risk level would be. The app uses Bluetooth rather than GPS to ensure no personal information is shared. Treatment, the third part of our strategy for reentry, focuses on isolating positive cases, ensuring that infected individuals have the care that they need. Students who test positive can isolate in one of our dorms prepared for this use, where they are given appropriate medical care and basic necessities while they recover, including intensive mental health supply. With this preparation, we welcome students back to our campus on August 24 for the fall semester. Though things look very significantly different than they did in March when we had to take a break. An average day last academic year would have seen around 60,000 people on our campus every day. Daily occupancy currently is now around 17,000 total students, faculty, and staff, with around 29,000 different individuals visiting campus at least one time during the week. We're offering a mix of in-person and remote instruction delivered in 4 modalities: in-person, flex in-person, live online, and our I-courses, or asynchronous online courses. The semester began with all courses online except for essential courses, those that can only be held in person. Overall, students are responding well, and they've been eager to get back to learning and pursuing their academic goals. We're hearing many stories of perseverance and resilience. We also continue to benefit from the innovative leadership of our faculty members who are contributing to these multiple reentry efforts. One outstanding example is our wastewater-based epidemiology program led by Dr. Ian Pepper. Dr. Pepper's team works with our facilities management division to collect samples from around campus, and they use PCR testing to detect the presence of COVID-19 in a limited geographic area, a dorm or a building. They use PCR to test wastewater out of these buildings. A positive wastewater test in a dorm allows us to test students in that building to identify asymptomatic cases quickly. As you may have seen in the news, a positive wastewater test from our dorms allowed a quick response that identified asymptomatic cases and the ability to move those asymptomatic cases to our isolation dorms before spread of disease could have occurred. We also have several initiatives in collaboration with local officials to promote and encourage compliance with basic public health measures, such as a face covering and physical distancing. A combination of city ordinances and our student code of conduct provide means of enforcement, along with basic education on public health practices. There's no doubt that COVID-19 will create and has already created lasting changes to our world, including in higher education. There are also opportunities for our institutions worldwide to lead in this new context. The University of Arizona was about a year into implementing a new strategic plan focused on the fourth industrial revolution, the confluence of biological, physical, and digital technologies, and the changes this will create in our broader society. There are many areas where this focus may be even more valuable in the world that is being shaped by COVID-19, such as telemedicine or automated mobility technologies. One area of focus in our plan is the built environment, which is an initiative named Restruct. Restruct supports an innovative approach to built environment research. It is truly transdisciplinary, reaching out to colleges across the entire university, as well as to civic and industrial partners. The focus is on grand challenges such as creating resilient and efficient urban and rural systems, or design of optimal healthcare delivery systems. If we think about all the ways our supply chains have had to adapt, especially where they have to become resilient, or how we've had to rethink the way we use public spaces, the importance of these areas of inquiry is clear. The university has also have an innovation form of international education through our microcampus network. A microcampus is a University of Arizona branded space located at a partner university around the world. Our faculty work with partner faculty from the host institution to design and prepare curriculum, and local partners serve as in-person teachers. This provides a great benefit to students who need or want a U.S. credential. They pay local tuition and costs and earn credits toward a degree at both institutions. Our goal is to offer enhanced accessibility to a U.S. degree without the need for physical mobility, which is particularly valuable in the global health context we now face. In this and many other ways, we are adapting our research and teaching to tackle the new challenges brought on by the pandemic. However, our mission remains the same, helping our students achieve their hopes and dreams while conducting fundamental research and creating applications in services and products that will simply make the world a better place. While we all face significant challenges, I remain optimistic and excited about our future. I really appreciate the invitation to share a little bit about what we're doing at the University of Arizona, and I look forward to the discussion and questions for the remainder of the seminar. Thank you.
Thank you, Professor Robert. We'll have the questions at the end of the talks. So it's my pleasure to introduce Professor Rui Oppermann from the south of Brazil. Please, Professor Rui.
Well, thank you very much, Professor Carlotti Jr. Also, I greet Professor Robert Robbins, President of the University of Arizona. And let me say, Professor Carlotti, of the acknowledgement of your initiative in promoting this type of seminars, and my thanks for inviting me to represent our university, Federal University of Rio Grande do Sul. My presentation will start with an overview of how nationwide we have been dealing with COVID-19. I will then move forward, commenting local aspects associated with the cities where we have campi. And finally, I will present how our university has been facing this challenge. In fact, Brazil and the United States have had so far similar responses to the pandemic, both in terms of infected individuals as in terms of the number of deaths associated with it. The number of cases confirmed in Brazil is today above to that observed in China, France, Germany, Italy, and Spain. In fact, only USA has a larger number. However, when the number of cases is calculated as proportion of the population, Brazil presents figures even larger than USA. As far as deaths are concerned, USA and Brazil present the largest numbers again. In Brazil, over 4.5 million persons have been infected so far, and almost 140,000 deaths are accounted for. Brazil suffers from the inertia of the federal authorities and the persistent denial by the presidency of the seriousness of the pandemic. As a consequence, the nation as a whole is not motivated to abide recommendations made by state and city authorities concerning public health measures such as crowding, keeping social distancing, use of masks, using of alcohol 70%, self-protective measures, and so forth. State authorities have taken the responsibility of issuing public health policies concerning how different sectors of the economy and society should participate in the effort to limit spread of the virus. As a consequence, different policies have been presented by the different states. In our state, located in the extreme south of Brazil, Rio Grande do Sul, our university has participated in a high-level council, together with other universities and representative sectors from the society, coordinated by the state governor, with the task of evaluating the distribution of the virus among the population and the infrastructure available for diagnosing and treatment. Our university hospital is today the state's largest center receiving COVID patients, and our biomedical laboratories have been performing diagnostics exams both for healthcare personnel as well as for the general population when this is demanded. This task force, together with epidemiologists and other professionals, have produced a system of flags that, according with the severity of the attack and the degree of response, establishes what are the activities allowed, in which degrees this is permitted, and what should be done in terms of prevention and control. So far, our capital, and where the largest campi of the university are present, have been under a red flag, which means that university should not carry on-campus teaching activities. We have suspended undergraduate activities since March 15, and our staff and faculty are advised to stay at home and perform activities in the remote mode. Since the beginning of July, after extensive and I must say exhausting discussions, we have started undergraduate activities on a remote fashion called remote emergency teaching, which so far is a tremendous success in spite of the challenges we have on the grounds of limited accessibility of part of the students associated with equipment limitations, as well as difficult access to the internet. The same limitations have hindered a wider post-grad activity as well. Same goes for research activity. Only labs working with issues related to the pandemic are allowed to function. Together with the modeling of the emergency teaching, a second group of experts have designed appropriate protocols to be applied when on-campus teaching and research are permitted by the local authorities. This group of colleagues produced a document where occupancy of different environments is calculated according to each flag. Laboratories, sports arenas, auditoriums, classrooms, libraries, cafeterias, restrooms, and so forth, according to size and nature of the activity, have varying limits of occupancy. Besides that, the document has established special routine care of common areas, sanitation, offer of antiviral antiseptics, special equipment for the staff according to different risks of exposure. Testing both for temperature and viral infection when needed is also underway. Precautions and recommendations upon the presence of suspected carriers and so forth. Two comments on this issue, I think, are associated with our socio-economical setting. Our main campus receives between 20,000 to 25,000 persons daily. The vast majority use public transportation to access the campus. The impact of these numbers in the local commuting system is a clear determinant of resuming on-campus full presence activities. Urban transportation in Brazil is one of the biggest problems facing local authorities. With no foreseeable solution on a normal situation, now you can imagine it with a pandemic being present. The risk for contamination under these circumstances is unaccountable. The second comment concerns the costs resulting from the application of the security measures advised by the expert committee. There is no doubt that sanitization, cleaning, providing antiseptics, equipment, assistance, and adequate infrastructure results in higher costs for the university administration. Federal universities are financed by federal budgets. Over the last 4 years, the budgets of the federal universities have been reduced to unimaginable 35% as compared to the budget of 2016. This is aggravated by governmental policies restricting the use of the budget. Now we are confronted with the perspective of higher costs with increasingly budgetary cuts. Unfortunately, the present Brazilian government does not consider higher education and research as priorities, even though university hospitals and research institutes are at the forefront of the battle against COVID-19. The last part of my presentation, I would like to exercise a moment of reflection on what have we learned with the pandemic and what may be the legacy we will have left when it is over. We hope it will be over somehow. When we refer to the new normal, there are some reminders on the expression. The old normal still will be here haunting us. The tremendous social inequalities present in our society will be aggravated by the socio-economical crisis associated with the pandemic. In Brazil, COVID-19 started in the high affluent classes, probably contaminated abroad. But today, the poorest segments of the society, and in special the poor blacks, are at astonishing 5 times higher risk of developing the disease and dying from it. On the other hand, there are definitely changes that may be permanent in our academic environment. For instance, home office is surely one of them, as it is the convenience of meetings, such as this one we are here now having. Administrative and academic meetings, research evaluations, and thesis evaluations committees, these and other opportunities are those where virtual environments definitely came to facilitate, cut costs, and increase efficiency. Distant learning has turned into a big issue in Brazil, as most private for-profit institutions have been using this resource to increase numbers of students, increase faculty burden, and so far with no established quality evaluation of this approach. Another argument against the massive use of this resource is that it fails to offer students an academic environment as part of the educational process. My personal view is that distant learning is a tool and not an end on itself. Brazil is a large country with socioeconomical asymmetries. Distant learning may be useful to provide access to higher education to many that will not have other possibilities of doing so. As public universities, we should offer this possibility, especially, but not only, in areas of high demand, such as the formation of teachers for the basic levels of education, badly needed in all Brazil. What I see is that the experience acquired with remote teaching, the infrastructure prepared for that, the development of abilities by the faculty and staff should be taken advantage of to extend the access opportunities in the post-COVID time. Prior to the pandemic, our university had a limited but very successful experience with this approach. In the post-pandemic time, I hope we will broaden its offer. A last reference I make is concerning research. We have been very active in areas pertaining the response to COVID-19. Areas such as health, medical, engineering, biological areas are expected to do so, but also humanities, social science, management have been involved in tackling different aspects of the pandemic in the society. The big lesson I learned from that is that COVID-19 has given us the opportunity, so many times demanded, of multidisciplinary approaches in an horizontal fashion in our research area. What we see is that researchers have finally discovered that this cooperation is very productive, both in terms of academic recognition as well as in terms of results. I am not sure how much society will change in the post-pandemic time. Perhaps because of our pessimistic feeling of how science and academic authorities have been challenged by denialists, flat earthers, and common sense. If we learn from the past, perhaps we will keep the positive legacies of science, of what science has given us following the Spanish flu, and avoid the economic recession and world wars that came also together with it. Thank you very much.
Thank you, Professor Rui. I have some questions for you now. I will start with Professor Roberts. Do you think Arizona will go back to what it was before? What has changed forever?
Yeah, I think as we both have shared our opening comments, there will clearly be some changes that will be long lasting. Just as Dr. Oppermann said, the priorities for funding higher education, particularly in this country, but certainly in the state of Arizona, have been cut. 10 years ago, we had major draconian cuts in our budget from the state, and we've not recovered. And I see the same thing occurring now. So we're going to have to be more innovative and use, as Dr. Oppermann said, distance learning and distance meetings like this, which thank you for organizing. I think this is incredible that we're so far away, but we share such similar experiences, not the least of which is political environment that I didn't touch on in my remarks, but certainly if you have been following what's going on in this country, there's a big political divide in our society. And I would say a major anti-science movement, not just around this pandemic, but around climate change and other things. And I fear that as we develop together as a global community a vaccine, my concern is, will everyone take that vaccine? So to answer your question, I think it'll take at least a decade for us to recover from the consequences of this pandemic, and it won't be the last pandemic that we'll face. I was watching an American gridiron football game, not the real football that you all play very well and know, but our version of American gridiron. And I saw some pictures from Atlanta, Georgia in 1918. And there were individuals in a stadium watching the game, and they all had their face covered. I think that that's a lesson that we all should learn. And it seems to be, as we were talking before the meeting started, very, very easy thing for people to do. Clean your hands, cover your face, stay away from as many people as possible. But we just can't seem to get there in terms of policy and compliance from our populations. But I am optimistic about the future, because I think we will learn, and I've seen the great resiliency of our faculty, staff, and students as we've tried to mitigate the consequences of this very highly transmissible and deadly virus. Most of our students, of course, are young and are asymptomatic, and they've had to learn about the spread of this virus and measures that we can take. But going forward, I think we'll have many more opportunities to use technology to help advance the mission of our universities, which is to educate the next generation of students, to discover fundamental knowledge and to translate that knowledge into commercializable products that can make the world a better place, and to provide access to all individuals who seek an education. So I do think that there will be changes for many decades to come, and maybe some permanent changes as well.
Professor Rui, the next question is for you. What's your opinion on mixed online and presential teaching universities in Brazil?
Yeah, as I said, I think that distance learning is a tool that should be used, and even in a larger sense in our universities. It's an inclusion policy which should not be underestimated. It is also challenging that I don't think that long distance itself alone can be a reliable form of educating on higher education. I think we have to have a mix of the distant learning and also of presential or presential learning as well. If you consider, for instance, the experience of living on campus, of growing your citizenship because of the groups of involvement with the life of the university, this is something which is very important for throughout all our lives. So a mixed combination of distant learning and presential learning is something that we would have to consider as a priority, in fact, because this represents less cost into teaching with an efficacy which should be the same, and at the same time it's much more democratic because you are giving the chance of segments of the population having the university experience which otherwise they would never have. So I think that this is something that post-COVID will have to be considered, even though there is persistent opposition to that by syndicates, by unions, by movements, because they fear that this will mean less teaching opportunities and so forth. I don't believe that. I think that in a policy of increasing the inclusion and extension of higher education to larger segments of the population, we may even need more teachers, more staff, more faculty to perform the activities needed for this type of activity.
Okay. Professor Roberts, a question from Professor Bagnato. Are we moving to a new area in graduate studies? I mean, limited access to laboratories, or will you close some areas of knowledge and invest in other areas? So do you think it's temporary, this problem, or it will be a permanent moving?
Well, I think just like the previous question, I think there will be some long-lasting effects, and it will give us an inflection point to re-examine the strategic areas that are important for our universities. But as we were rolling out our strategic plan right before COVID struck, clearly more focus on the fourth industrial revolution that I referenced in my opening remarks around high touch, high science areas such as engineering, medicine, computer network and digital sciences, but also remembering that it's very, very important for fundamental knowledge to be imparted to our students around leadership, around critical thinking, around cooperation, collaboration, communication. These are all things that are provided by our social and behavioral sciences and our humanities, and we can't lose sight of that in this post-pandemic world that we're going to be entering in. So I think that we're going to have to make tough decisions about where to invest strategically the limited resources we have. But I'm confident that our entrepreneurial and innovative spirit will allow us to continue to support particularly the humanities. We have a very innovative applied humanities college at our university. And I've been so impressed with not only what they're doing, but our fine arts programs and how we've been able, even in this pandemic, to keep our orchestras, our dance programs, and our fine arts programs going at a high level. I do think that Dr. Oppermann hit on one important issue around more widely distributed and scalable distance and online education, and that is rigorous attention to detail of the quality of the product that we're providing our students, and learning objectives and assessment. And so we're all going to have to adapt and respond to that in the future.
Okay, now I have the last question for both of you. First, Professor Rui, are you positive about the continuity of the proximity that COVID-19 creates between universities and governments post-pandemic situation? I guess Professor Rui is not listening very well.
Yeah, no, I didn't get your question. Excuse me. Can you repeat it again?
Are you positive about the continuity of the proximity that COVID-19 creates between university and governments? Because now the government, they say that they believe in science, they would like to invest in science. Do you think it's permanent or just for the COVID-19?
Yeah, I'll comment on that based on the experience we have had with the state government and the city government of Porto Alegre, which has been very positive so far. Yes, I think that COVID will also bring us closer in terms of investment, both in research and science. And I was listening to Professor Robbins, and I think that also the entrepreneurial and innovative policies that we have been developing in our university will be recognized by the state authorities as a potential for development of the state and of the city. So in this part, I'm very positive and very optimistic. I think, yes, that governments will recognize the importance of the federal universities, of the public universities, in the contribution with research, with science, and with involvement, also social, economical involvement, as part of the development of the states. All states in Brazil have difficulties, economical difficulties, and I think they have now a better recognition that university can be one partner for the development of the state and of the policies the state so badly needs, and without very much financing from the federal government. So my straight answer is yes. I think that politicians have learned the importance of the public universities in terms of what we can contribute with, not only with the emergency things, but also on the development of the state and of the cities. I hope this will also come back again to the federal government as well.
Professor Robert, please.
Yeah, I would say the same thing. It's so remarkable how we share the same challenges and the same opportunities. You know, our university has an extremely strong astronomy and space science program. We have 4 major international telescopes that surround our campus here in Southern Arizona. And I think that for those type of things, including optical sciences, we were just awarded a major grant by the National Science Foundation and the White House, Trump's White House, for quantum network computing. It's tantamount to the investment our government made in the internet in the 1980s. So I am optimistic that there will be some swing of the pendulum, not just to address this public health crisis that we all face globally, because we're all so connected around the world, but also looking to the future about the importance, particularly of the public universities that are focused on research and for economic development in our local municipalities and states. So I think there will be a lot of opportunity, but we're going to be in the short term required to do more with less resources, and we're going to have to be resourceful and being more efficient on how we run our universities with the limited funds that we have. But I continue to be optimistic.
Okay, I have one personal question for Dr. Robert. How the Arizona University deal with the mental health during this crisis for the students and staff and faculty?
Yeah, even before the pandemic, again, I think it's we live in parallel universes here, that we share so many things. The stress, particularly in our healthcare workers, but also in our faculty and staff across the university, because of these issues of having to work harder, and certainly during this pandemic, those deficiencies that we had before the pandemic started are just amplified. So the amount of depression, isolation, hopelessness, the lack of social interaction. We're all social beings, and we derive a lot of benefit of being around other individuals. I think there's been a tremendous toll taken on our entire society through this pandemic, but it was present before. And so we've focused a lot of effort on delivering mental health providers to our students for sure, but also to our faculty and staff. And we've used telemedicine. Telemedicine is something that's been around for 4 decades, but I think with this new Zoom model, I, as a heart surgeon, are reviewing angiograms and echoes over Zoom, and having consultation with patients over Zoom. And many doctors are doing this, and that certainly applies to mental health as well. So the ability to have FaceTime with someone and just give them the opportunity to talk to another individual and share the despair and difficulties they're having is something that we've put a lot of effort toward during this time of crisis.
Okay, thank you very much for both of you. It was a great talk. Thank you very much, Professor Robert, Professor Rui. And I hope you can come to Brazil in a better time without COVID-19. And Professor Rui, you are welcome in our university. When you come to São Paulo, please visit us at our campus. So thank you very much.
Thank you.
For all the audience also.
And you're all welcome to the University of Arizona. We'd love to have you, but I look forward to my trip to Brazil in the very near future. Thank you for including me today.
Thank you. Yeah. Professor Rui, your microphone is off.
I was just saying that for our mental health, it's badly needed that we are allowed to travel around to São Paulo, to Arizona, and to other places home office is something very, very stressing and extenuating to all of us.
Indeed.
Thank you very much for the opportunity.
Thank you very much. See you soon. Thank you very much.
Bye-bye.